Hello, everybody. This is Gary. Today is Monday, April 3rd, 2023. It is 11:57 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. I haven't made a video in a long time because I've been having a rough time over the past few weeks. My paranoia has been pretty bad. My auditory hallucinations have been pretty bad over the past several days. My depression has been pretty severe. My motivation to do things is way, way down. Um, my paranoia and delusions are pretty strong. My anxiety levels are pretty high today and have been for the past few days. Um, my thinking has been kind of muddled, confused. Um, so I wasn't sticking to my daily schedule. I did keep my appointment with my therapist last week, and I have another appointment with my therapist on next Monday. I'm seeing my psychiatrist, I believe, on the 14th of April. They're aware of what's going on. I'm not violent or suicidal or anything like that. I was tempted to go to the psychiatric emergency room a few times, but unless I'm suicidal or potentially violent, going to the psychiatric emergency room really doesn't accomplish anything because it's a very confused environment, yelling, screaming, violence from other people. It's not a place to go if you're looking for relaxation. And that's an understatement. Um, I am sticking to my daily schedule today. Um, I'm making this video to do an update because I haven't done one in a while. I am about to do my physical therapy exercises. Um, my medications haven't changed. Um, and I don't see any reason why they would be changed at this point. Um, but I will be talking to my psychiatrist on the 14th. I have an appointment for a CAT scan of my chest this upcoming Friday. That CAT scan is to check on how severe my pulmonary fibrosis is. Um, I saw the pulmonary specialist last week, and they told me that I'm not going to die in 3 to 6 years. That's information I got off the internet that was inaccurate. Um, I'm not dying at all from pulmonary fibrosis, although it does make it more difficult for me to breathe when I'm walking or exercising. I get winded very easily, and that's due to the pulmonary fibrosis. So the presence of pulmonary fibrosis is real and the effects are real, but I'm not dying from it in 3 to 6 years. Um, we're still not exactly sure what the cause of the pulmonary fibrosis is. I smoked cigarettes for more than 30 years, quit about 15 months ago. It could be the smoking, it could be something else. We don't know. If they never find out the cause for pulmonary fibrosis, we call it idiopathic pulmonary fibrosis, which means it's an unknown cause and the scar tissue may or may not spread. The scar tissue is not cancer, but the scar tissue can spread if there's an irritant, a chemical, sawdust, some sort of irritant that irritates the lungs can make the scar tissue spread. Um, that part we don't know yet. But I will be going to that lung scan this upcoming Friday, and then the pulmonary specialist will contact me for an appointment in about 3 to 4 months. So this is something we're just going to keep an eye on and observe as time goes by. We did not initiate any treatments for the pulmonary fibrosis. There are 2 medications approved for it, but my pulmonary specialist didn't think that was necessary, and you also didn't think that a biopsy was necessary, which are both good signs. Um, but beyond that, I'm just trying to stick to my daily schedule, my exercise. I already meditated twice today. That helps with anxiety and depression, and still taking my medications the way I'm supposed to be, and that's pretty much it for now. Comment, like, share, subscribe.